I think that engaging consumers in our work at Quality Counts, both in our governance and in all the projects we're doing, such as the Patient-Centered Medical Home pilot, is definitely improving the care of patients.
I don't really know what it's like to be on the clinic side of things. And that's fine, because that's not what they're seeking. What they're seeking is input from a patient. Well, I am a patient.
We found that they could be a reality check, that some of the negative comments that we were hearing, were these reasonable, were these appropriate? And so they gave us a kind of a broader picture of what we're trying to do with our practice.
We developed a form about 3 years ago called an after-visit summary. It tells the patients after their visit what they should do at home and what happened during the visit. But, you know, we didn't make it mandatory, and the doctors, you know, used it when they felt like it, and our patient advisor said it was the most important thing that we could possibly do for them. So I think we developed a really good tool, but we didn't get the most out of it, and our patient advisors really allowed us to revisit that and change our opinion. One
of the earlier projects was working on the medication reconciliation project and taking a look at the form that was provided to patients when they come in. And we made some recommendations about information on the form that would help it be better understood. The providers in the practice reported to us that they have seen that make a difference, that patients have a better understanding of the medications, not only what they're taking, but what they're taking them for.
And we had the director of IT come and explain to our patients what are the barriers for actually implementing electronic records, you know, into a practice. And one of the other things we did as part of that is we asked the patients to critique the physicians, and we gave that feedback to our providers. Say, our patient advisory board recommends that we do this, this, and this when we're using a computer, that we look at them when we're talking about personal issues, that they don't mind if we're using the computer during this part of the exam. And that was really helpful feedback.
Part of the patient-centered medical home as well is to do patient surveys. We take all those questions and results and bring them back to the patient advisory team. They help prioritize the changes that we want to make in the office.
And as a result, the last question, would you recommend Seaport Family Practice to other patients who might need a practitioner? That went up the most.